Okay, good evening everyone. This is the 8 o'clock hour of the Diana Wright Show. Welcome to the program from around the world and in the United States. My special guest, it is Tuesday, so it's Dr. Melanie Simpson. She is joining us now, and I have lots of questions to ask her as usual, but if you have great questions like the one we had last week about the size or the depth of the vajayjay, that was an awesome question. You can call us and ask us your own question because, hey, I'm just picking some questions at random to ask. So you can join us and let us know if you have questions. Don't forget that April 30th is International I Love Me Day. It's 2014, but I tell you what, time is just flying by so fast that I feel like it's going to be tomorrow. Okay? And just, making sure that we keep reminding you that it is crucial to love yourself. I was just watching something that was quite funny on television. I'm going to get Dr. Melanie's opinion. The reporter was asking a little kid, they were talking about, safety with your children, what you should teach them and stuff. And the reporter says to the little girl, "What's your mommy's name? Your mother's name?" And she goes, "Mommy." And she said, "So what's your dad's name?" She says, "Daddy." And then the little girl, is getting upset with the reporter because she's like, as if to say, "Why are you asking me that? Their name is Mommy and Daddy." So, hence parents, you need to tell your little children your real name. Your real name is not Mommy and Daddy, okay? So I thought that was the cutest thing ever. And for those of you who my good friend, okay, I don't know what happened to Dr. Melanie there. She's going to call us back anyway. It's like, okay, you're wearing high shoes, and despite the fact that they say if you wear high heel shoes too often and too long per day, then guess what's going to happen? You're going to start having pain in your foot. Okay, I'm not quite sure what's going on with Dr. Melanie's signal. We kind of losing her, gaining her, because somebody must be calling on her phone. You cannot be calling her when she's on the air live, okay? We just don't need that to happen. So I thought it was quite funny that the little girl thought that her mom and dad's name was Mommy and Daddy. So they're asking you, and they're also asking you to have your teenagers tell you what's going on online and show you the dangers of being online, because they're on there so often, and we don't know. We need to learn from them what are the dangers of being on the internet. All right. So for my very good sweet friend, your heel and your foot is gonna start hurting you after a while because I know you love high heel shoes. Okay, Dr. Melanie, I'm not quite sure what is happening on your end, but we're not getting you again. And if you would just ask, no, I need to not do that. So, all right, so until we get this sorted out here, we're going to just remind you of a few other things, that if you would like to get some more information about, I think I'm going to have to invite one of the board members of the Save a Life Jamaica Foundation to come online and talk to you about the white party that's coming on stream soon. All right, so boy, these technology things just drive you bananas sometimes. They just don't seem to do what they're supposed to do. Okay, there you go. I guess she can call right now. All right. And don't ask your teenagers to help you with anything, because they have a chippy attitude that just annoys me. Especially if they know a little bit more than you do about something that you're doing. Don't ask them. They just, get this little chippy attitude thing going on. And when they ask you to do anything, they would like for you to just jump at it instantaneously. I don't think that's right. So, as we wait for Dr. Melanie Simpson to call us back on Skype, then we will proceed with all the medical questions. But in the meantime, I just wanted to share with you something that I saw that I thought was quite interesting. And I actually love it, so I'm going to do this. Okay, I guess she's calling on the phone. Hello, Dr. Melanie?
Hi, good night.
Yes, I guess we just couldn't get the signal going there on Skype.
I don't know, but for some strange reason, it kept dropping.
Oh, yes. Oh, that's what was happening. Okay, I thought someone was calling you. Okay.
No.
Okay, great. All right, so let's just get started here. I don't know if you heard of this story that was quite big online and probably still is going on because they're trying to get some special treatment from the government, even though Secretary Sebelius has kind of said no, she won't intervene. It's called dilated, what is this, cardiomyopathy. And they have 5 children, yeah? And this, they say, can be sparked by a virus. 70% of cases can be traced to genetic mutations. But these 5 children, all of them except one, has this dilated cardiomyopathy. And it was kind of strange because they all needed some kind of transplant or something. And I couldn't figure out what this is and why is it that it would affect one family. I mean, the mom and dad, you could see they were so devastated because one of the kids already had the surgery. Then while they're there, they decided to test the other kids and they had the problem. And then it was just one child who did not or have not shown any symptoms yet. So what is this and why would it just attack a whole family like that?
Well, we know it as DCM, which, it's the same dilated cardiomyopathy.
Right.
But basically what it means is there's significant enlargement of all the actual structures in the heart. So all the chambers are dilated.
Okay.
And the problem with that is, for most children, there's what they call an idiopathic cause. So in other words, you really don't really know 100% why it is that a child develops this particular abnormality. And in some cases, a patient or a child can have myocarditis, which, is a virus. Most common, the Coxsackie A or B virus can actually cause that. And based on that particular virus, then they can develop enlargement of their vessels because at this point, their body is not able to operate the way it should.
Is it unusual for you to have 5 kids and 4 of them have this problem?
Say that one more time.
No, I was asking, is it unusual for 4 or 5 children in the same family to have the same problem?
It all depends on the causative agent, but it is possible, unfortunately, for that to be the case. That can actually happen. And, sometimes there are patients that have what they call abnormal Stokes diseases, so abnormal enzymes in their body that does not operate the way that they should, and that can cause significant enlargement of the heart. So that is possible as well.
Okay, alrighty. I truly felt for that mother. You could see that she was like, okay, I am done. I cannot do this anymore. It's like, wow, how do you cope with something like that? It's just actually crazy, I thought. So anyway, so that's what that is, and it can happen, and it is happening to Jason and Stacy Bingham, and they have 5 kids. They live in Oregon. And I was just wondering, I'm going, okay, is it something in the environment? What happened here? I mean,
In some cases, there are autoimmune diseases that predispose children to actually getting that as well.
Okay.
So, it's an unfortunate situation, but in many cases, if you think about genetics, between 25 to 50% of the cases are based on a genetic predisposition. And in some cases, there's a particular antigen, they call it human leukocyte antigen, CR4, that can be associated with this as well. And it just depends, they're what they call different ways in terms of how a family member can actually be affected. So if the disease is autosomal dominant, then more cases than not, the children will actually follow up with having this abnormality, whatever the disease state is. And then if there's an autosomal recessive case, then about half the children will be affected in comparison to about 75 or more % of the children being affected.
Wow.
So there are many, things to think about when somebody presents with this particular disease state.
Okay. All right. I want to move now to the morning after pill. There's big news today that the Obama administration has decided to drop their resistance to it being sold to anyone under 17. So now there's no restrictions. Anyone can go and actually buy this pill. So could you just tell us, I know some people are saying it's a moral issue, it's a political issue. I'm kind of on the side of, young girls are really having their periods very early these days, like 8 years old and stuff. So are we saying that we're saying to those young people, okay, it's okay to go and do some stuff because you can get rid of it? Or is it a political thing where they're saying that President Obama, now that he's not running for any office, he decided to dump it? And there's another school of thought that says that they couldn't win anyway because it's your right, if the thing is available, to go buy it. So there can be no...
I would like to clarify for our listeners because, first of all, it's not a matter of endorsing, that a teenager goes out and, gets the morning after pill, but neither are we endorsing that teenagers go out and have abortions either. So it's kind of one of those catch-22 situations. Well, nothing where, as practitioners, we don't have that jurisdiction where we can be in a controlled environment to make sure that these particular drugs don't get into the hands of the wrong, irresponsible individual. It's an unfortunate situation where, now you can just go to the store and you're buying, cough medicine or you're buying some other over-the-counter drug, you can just pick this up.
Right.
In some ways, there's some teenagers or just children in general that are going to think this is a form of birth control,
right,
where, I can do what I want to do, and then, just to make sure I don't get pregnant, within 72 hours I pop this pill. Well, that's fine. Good. However, like I said, any kind of hormonal changes to the body can significantly affect your body. So there are other things that you have to think about as well. And in many cases, somebody who does take this particular drug, after a while, if you want to have children, this is something that you have to think about. So it's not an easy ride to say, okay, I just had intercourse with somebody yesterday and, I clearly don't want to be a parent. And that's why we go back to abstinence and the idea of abstinence. And if you decide you can't be abstinent, then at least at baseline do wear condoms. But in many cases, people don't want to do that either because they would rather just have that pleasurable experience. However, when we talked about previously, you can take the morning after pill and prevent a pregnancy. That's fine. However, you may not necessarily prevent an STD from actually attacking your body. So, that's the other thing that people have to think about.
But let me ask you this, Dr. Melanie. How does this pill, how does it work? Because I know it's been in France for a long time and parts of Europe. But the thing is, if you have sex and you literally got pregnant, is this thing really gonna get rid of it if you take it the next morning for real, or is it just this something that we're hoping will happen?
Kind of like we discussed on the show last week. If you have a case where you do have intercourse with somebody, you have the sperm has 24 hours to make it up to that tube to get to the egg. Okay. In order for conception to take place. So it doesn't have 10 days to swim and then it makes it there and then you get pregnant. That's not the case. So if the sperm doesn't actually fertilize the egg within that time frame, it's going to die. Why? Because our bodies as females are it's an extremely acidic environment and it's created to prevent us from getting germs.
Right.
So any kind of foreign material, the body is trying to eliminate that. and not allow it to be exposed to that in the risk that there might be a potential infection. And so if, the person is successfully impregnated during that time frame, I mean, they have 72 hours to be able to take this, and levonorgestrel is the actual ingredient. So the idea is that you're going to prevent any kind of implantation from occurring, so the body just shuts down and acts as something already happened to prevent any actual implantation from taking place. That's kind of the idea of what the body wants to do. So
right. So
it does work. It does work for because there are patients that I have that actually do use it, and it does work. However, it is not an escape mechanism, and I think that's what the problem is. That a lot of people believe that it's an escape mechanism, but it's not.
Okay, what are the dangers of this pill? Are there any dangers that women and young people especially? Because I just have this gut feeling that a lot of teenagers are going to be trying to get this thing once it becomes available, because in their little heads they figure, okay, this is my way to do what I want to do, as you just said. Is there any caution that we need to truly put on this thing? Apart from the fact that we know that we should not be doing it all the time and using it as an abortion pill, if you will.
Well, it's like anything. Everything has an opposite and equal reaction, and that's just the way that the body responds. So in many cases, you have, people that say, okay, fine, I had sex and now I want to avoid having any kind of pregnancy to occur.
Right.
And, in some cases, people have severe nausea. Some people might have vomiting. Some people might have abdominal cramping. You know what I mean? So it's kind of like the side effects are pretty temporary because, this is not going to be in the body for an extended period of time.
Right.
However, for it to be effective, most people either have to take the 2 pills in the packet at once, or they have to take them within a 12-hour period to make sure that, it actually works the way it should. But in some cases, somebody might take one and then they might forget. And then the other thing is it can make people dizzy as well.
Really?
So,
okay. Wow. So it's 2 pills. They talk about morning after pill, but it's actually 2 pills that you're taking.
Yes.
Oh, okay. I thought it was 1 pill. Okay, so here we go. Straightening out the information. Not that I will ever need that. I'm too old for that now. But and even if I wasn't, that's it. You lock shop and forget about these things. Make up your mind what you want to do. Because I don't know. I see all these women who cannot afford it having 5 children, and I'm going, did you kind of think about college and those things and clothing and food and all of that? Do you know how much it costs to raise a child, So, and it's always people who cannot afford it that are having all these children. It just seems that way to me anyway. Maybe I'm incorrect, but, on the outside looking in, it seems that way, that it's mostly people who are not able to afford 5 children or 6 children are having 5 and 6 children. So.
Well, to be honest with you, I think there are a lot of things that people don't think about and they become an afterthought. And really and truly, before you even engage in adult behavior, you really have to consider all these things because, you may take Plan B and not get pregnant, but like I said, you have the risk of an STD.
Right.
It actually can reduce the risk of pregnancy. This is the Plan B 1 step, as they call it. Probably about 89%. And if you take it within 24 hours, then it's about 95% effective. Okay. But it should not be the main form of birth control. Abstinence is your main form of birth control.
Oh, so you mean it's not 100% proof?
Say that one more time?
It's not 100% sure that you're going to abort?
No.
Whoa. Okay.
No.
So how do you know that it's going to work for you then?
You don't.
Wow.
Don't.
So you mean you're taking these pills to do all these things in your body and you're not sure it's going to work?
I'm going to give you some examples of what people present to my office with and tell me why they would take Plan B. And, you know, there should always be a plan A, and, I mean, plan B should be, okay, I'm married, I'm responsible, and I'm ready for this.
Right.
But if you know, people present with, they don't have any form of birth control, and they figured, you know, this is something to do, and then cases where the condom did break, and then other times they have diaphragms and it slips out of place.
Mm-hmm.
And they'll say, you know, they miss taking their birth control pill, so it's kind of like a catch-up.
Right.
Or in some cases, some people are using NuvaRing, they're using, and they didn't, you know, they forgot to either of the two.
Right.
Or they tried the withdrawal method and it didn't work, so now they're withdrawing.
the famous withdrawal method.
And then there's the story, oh, you know, he wanted me to do it, or she wanted it, and what?
Okay, are you there? Hello?
I'm here.
Okay. No. I thought I lost you for a minute there. Okay. All right. So it's not 100% foolproof, ladies.
It's not.
Because I really thought it was. I didn't know that it had a 5% chance of not working. So you might want to keep that in mind. And you might want to also keep in mind that this is not a form of birth control. It really isn't. Okay? So for those of you who can't wait for it to be is it available yet or is it not? Because I'm told that it isn't really widely available. What does that mean?
Say that one more time?
I said, is it widely available or is it not?
It's, you know, it's one of those things. There are certain pharmacies you can go to, because I've seen this happen. That's the reason I can make this statement.
Mm-hmm.
But there's some pharmacies you go to and they'll tell you, no, we don't have that. And then there's some places where they'll say, yes, we have it. So, I mean, to some degree, I would say it's pretty much widely available. It's just now it's going to be like candy.
Ah, okay, that's the difference. Okay.
You know, before it was quote unquote behind the counter, controlled by the pharmacist. But now, you know, it's kind of like standing in front of the pharmacy counter and you want a pack of gum and you can pick the pack of gum up, pay for it, and walk out.
Right.
It's kind of the idea now where it's, you know, a lot more available and a lot easier to obtain compared to before.
Mm-hmm.
You know, you have to be a certain age and all of that to be able to get it. But still, it's not cheap either.
Oh, it's not? So you mean it's more expensive than birth control, I would imagine?
Technically, yes, because I've seen, I can say this, I've seen on numerous occasions where sometimes when you're in the pharmacy and you go to pick up a prescription, just entertain yourself. Don't eavesdrop, but just entertain yourself. Because you really learn so much by just standing there and listening. And in cases, and I'm not saying this to be comical, but in cases, you know, I've seen people come in and they show their ID and they pick it up and, you know, they're the appropriate age or whatever the case might be. But at the end of the day, they're paying $40+ and in some cases even more.
Wow.
To be able to see it.
Okay. I was kind of wondering too at some point if the pharmacist could kind of say, no, I think you're too young for this, but then I guess the pharmacist would get in trouble and be sued and all that kind of stuff because we live in the land of lawsuits, so I don't know. Anyway, there goes the morning after pill, and it's also called the morning after pill and it's called Plan B, right?
Right. And I mean, the other thing that I did not mention is, you know, if somebody suspects that they're already pregnant, there is no point to even taking this.
Ah.
Or you have an allergy to the possible ingredient, or you have a history of abnormal vaginal bleeding, because you don't know what kind of side effects you may potentially have, because it can cause menstrual changes too in some cases. So, you know, it's not as easy or simple as it sounds. You know, I said that last week, what's good for the goose is not necessarily good for the gander, and you really have to be careful because you might just be the one out of a million people that really has a bad outcome.
Right. Okay. So there are some dangers that people need to keep in mind because one of my curiosities about the whole thing is, okay, if you just make the 72 hours and just maybe you are pregnant already.
It's possible. But remember, I said the sperm has 24 hours.
Right, but they're saying that this pill can be used after before 72 hours.
Right. So here's the thing: because it would like to have a conception take place.
Right.
So anywhere along that journey, depending on when you take that pill within 3 days, you can stop the process.
Yeah, but isn't there a possibility though that the sperm will travel really fast and get there before you can get your pill going on there?
Nature is so funny and God's creation is so amazing. I would definitely say anything is possible.
Okay.
It's only typical cases because, you know, if somebody comes in, for example, this is kind of off the subject, if somebody presents with a potential heart attack, they may not necessarily say they have chest pain. They might be somebody who says, oh, I just felt dizzy and I felt weak and I was short of breath. And not necessarily. So they're atypical cases where somebody potentially can get pregnant and not really think they're pregnant at that time, and you know things have already kind of moved right along, or you know, in a different place. So I would just say to young women, or even mature women who you know would like to decide that this is their form of birth control, I would just say be very responsible and talk with your physician. Don't just assume anything because, you know, just one unfortunate outcome, you know, can be your life.
Yeah.
Or something pretty significant can happen, and, you know, what do you do at that point?
Right. Okay, well, my special guest inside the Diana Wright Show this evening at the 8 o'clock hour is Dr. Melanie, and if it's Tuesday, we have Dr. Melanie in the house, Dr. Melanie Simpson, and it's interesting that you brought up heart disease or heart attack or whatever, because that's one of the things I have on my list, because I wanted you to kind of let us know the difference when a male is having a heart attack and a female is having a heart attack. Is there a difference in the symptoms that they will experience?
Not necessarily that there's a actual particular difference. I had intended on bringing up last time is when somebody presents with chest pain could be, you know, from muscle strain to what we call costochondritis. So, you know, you lift up a heavy bag. You know, women these days, their pocketbooks are probably more like
more than the heavy bag.
Right. So they're at least 5 pounds in many cases. So, you know, it could be muscle strain to the chest wall that causes pain. It could be indigestion, so somebody has heartburn. Can cause chest. Somebody has and in addition to that, there are times when somebody is actually having a heart attack. So, you know, chest pain, so I guess definitively I'll put it this way. Chest pain that lasts at least 30 minutes, so this is for a heart attack. Chest pain that lasts at least 30 minutes in most cases is associated with increased sweating, what we call diaphoresis. There's also shortness of breath, and in other cases, the pain radiates to your left arm, your jaw, left face, you know, or the pain wakes you up from sleep, the pain occurs at rest. You know, that's what they call unstable angina. So that's what you have to be concerned about is the duration. 30 minutes or more, that's pretty significant chest pain.
Okay, so are we talking about women and men, both that would have that kind of symptoms?
So men and women can present with those kinds of symptoms, and one of the issues in cases, women, you have to be extremely careful because sometimes women might say, oh, you know, I feel a pain kind of in my breast area, and it might be actual cardiac symptoms. And so you have to be very concerned and very careful with women, especially elderly women, because they present kind of atypical. So they might just say, I feel really tired, I feel really sleepy, or I feel really short of breath, and they're actually having a heart attack and not necessarily complaining of chest pain.
Oh, okay. Is there something about cramping in the leg or something for women that could be signs of getting a heart attack or something like that?
Okay, so one of the big important things that you have to consider as a differential diagnosis with chest pain is worst case scenario pulmonary embolism, and that would be an actual blood clot that occurs in the lung. And that usually travels from the lower extremities. So you have a clot in your leg, the DVT, deep vein thrombosis, and then that travels up the wall and actually hits the lung. Now, if you were to get what they call a saddle embolus, which is the main pulmonary artery, gets a clot, then that's death. So the saddle embolus results in death. However, people can have pulmonary embolism. So sometimes, people are extremely obese. Sometimes there's trauma that can cause a pulmonary embolism. And in many cases, people who take very long flights, so, you're flying from here to Japan, and you start having significant chest pain, that can also be a pulmonary embolism. And then the other thing sometimes that people have is what they call an aortic dissection. So the big vessel, the aorta, that supplies the body, for example, if somebody is in a car accident and they have trauma to the chest, sometimes you can have instant death because they've actually dissected or ruptured the actual aorta. And I mean, that's significant bleeding that will occur within the chest cavity. So there are many, many things. And that kind of chest pain is usually very sudden, and it usually radiates to the middle of the back, upper back.
Ah, okay. All right. Wow. Anyway, let's go to something that happened miraculously over the weekend. The crazy glue, which is medical crazy glue, that was used to stop a brain aneurysm in a baby, because the doctors were explaining that the veins that are there were so tiny, there were no instruments to do anything like this in a baby, and they used glue. Medical glue to stop the bleeding. Yes, no, I was talking about, there's a doctor, I think this happened in Texas, if I'm not mistaken. In Texas, there was an infant that was normal, and then all of a sudden started crying, and nobody could figure out what was going on. And then when they took the baby to the hospital, the doctor realized what was going on. The child was having an aneurysm, which I guess is a stroke, right? And there was bleeding in her brain, and the doctor, in order to stop the bleeding, he used crazy glue. Well, they say medical crazy glue, so I don't know what's the difference between...
Yeah, there's surgical glue. Yeah. So if somebody has an aneurysm in the brain, I mean, it's basically, it's kind of like a ballooning of the artery. So if you picture like an artery, like let's say you blow up a balloon and you kind of stretch it a little bit, and then all of a sudden there's a little area that kind of forms like a half moon or a little pocket. That's kind of the aneurysm kind of looks like. It's a ballooning of the artery. So if somebody was to have a brain aneurysm, you can do surgical clips to that area. But if you don't have time to do surgical clips, then sure, surgical glue will work, because, I mean, the faster you control the bleeding, I mean, preventing death is really the primary outcome. So that surgical glue, because even sometimes when, people have their gallbladder taken out or other, surgeries, they'll use glue instead of actually suturing or stitching the area, because it pretty much has the same, like if there's a deep wound that, they have to repair, then underneath you're doing the sutures or the stitches, and then on top with closure of the skin, once you've approximated the edges and make sure, it comes together well, then you can use glue to actually close it. So, yeah.
Okay, so the miracle happened, and the baby was saved, and the baby got better instantly, they said, and, we're just giving God the glory for that. So my special guest, Dr. Melanie Simpson, inside the Diane Wright Show, live at 8 o'clock. It's Tuesday, and we thank her so much for joining us as we continue asking some medical questions that are important for you to know and for you to think about. And we are going to go now to this one, which is, I am like wondering if there's some conspiracy to let everyone have diabetes, because I've never seen anything that has just exploded. Every person you speak with is diabetic. What is going on in that genre?
Well, the big thing that's going on with regards to diabetes is diet. If you look at it now, I mean, before there was only, let's say, McDonald's or Taco Bell or Popeyes or Church's Chicken, or, you know what I mean? But now Everybody is on the run. It's a eat and run kind of society that we live in. So nobody wants to take time to cook, and everybody wants Chinese food, and they want this and they want that. So we're on a quick fix system, you know. And so because of that, people don't really pay attention. And then the other thing we do, so we're not watching our calories. We're just eating. And in many cases, like we talked about my very first time on the show, we're not eating to be full, so we're overeating. And that food has to go and lodge somewhere. So, you know, your liver takes the work, or your liver, you know, has that work to do, because now your liver has to convert these different foods, whether you took in carbohydrates or proteins or fat, and convert it so it can store it. So when you need it, it can, you know, convert it back to the form that the cells can use to be fed. And so because of that, our society is extremely obese. And, you know, that's one of the things that develop in many cases, where obesity can lead to glucose intolerance. And glucose intolerance just means your body's insulin is really not responding the way it should. Because when you take in a sugar load, so when I say a sugar load, if you have a high carbohydrate diet, so let's say you go to McDonald's and you say, I want large fries times 3, you know, and I want, I don't know, a McChicken sandwich or whatever the case might be, and then I want fruit punch, a large fruit punch. So now you've taken sugar and you've taken carbohydrates and some protein. Now your body is going to take that sugar load, and what it's going to do is it's going to release spurts of insulin in order to make sure that your blood sugar doesn't go to levels that the body cannot handle. So it's going to release extra insulin as long as your pancreas is functioning properly, to make sure that your body is able to handle that sugar load. So if your body is not able to handle that, that's when you start to develop glucose intolerance. So now your body is not really responding the way it should, you know, and so that's what can predispose you to having diabetes.
Okay, so some people will say, okay, it's the carbs that you eat, the potato and the bread and the yam and all that kind of stuff that gives you this diabetes. Some people say, no, it's your sugar intake. Which one is it?
It's both.
It's both.
Because if you're not watching your amount of calories, it can also affect you in a large way. Because to control diabetes, depending on the type you have, because there's also autoimmune diabetes, which is type 1, and that usually, you know, people are usually diagnosed before the age of 30 years old. And so with that one, people are insulin dependent. Why? Because their insulin receptors don't exist anymore, basically. They're beta receptors, which are, you know, is what releases insulin from the pancreas. So those are non-functioning. So now you have to give them exogenous, or out of the body, you have to introduce insulin into their body. So endogenous, we make; exogenous, it comes from somewhere else. And so those people are dependent on insulin. So you can give them oral medications, it's not going to do anything, because they actually need insulin. And then there's some type 2 diabetics that they have to be controlled with insulin in addition to oral medication. So with regards to diet, one of the things we recommend is watching your sugar intake in terms of high starch foods, a lot of sweets, a lot of caffeine, things like that, that's going to get converted to sugar. In addition to that, we recommend diet, we recommend exercise, we recommend weight loss, you know, because the more fatty tissue in your body is going to be in love with that, you know, in terms of elevating your blood sugar. So, you know, there's so many factors that you have to consider for somebody who is diabetic, because worst case scenario, you don't want that person to end up in a diabetic coma, you know, because the blood sugar is not controlled, because that's a very dangerous place to be.
Okay, because I remember Luther Vandross, who died because of his diabetic issues, and I was watching something the other day, and they actually gave him the credit for creating a burger that you put the meat in between a Krispy Kreme donut, and they said he's the one who created that burger. And
you're talking about the burger I just saw on television?
Huh?
I just saw something on television that I thought was so absolutely horrendous that I would not put that down my throat. But that's just me.
And no, I'm telling you, when I heard that, I thought, okay, he's diabetic and he's eating donuts and burger meat. That doesn't even make so they call it the Luther Vandross burger But what it contains is...
Luther Vandross is no longer with us, and if he was, I'm not exactly sure he'd be very fond of that idea. I think he might have liked Krispy Kreme, and he might have liked the burger. I don't know about the combination.
Well, I'm telling you, but this is a restaurant that he used to go to very often, and they said he created that burger, so they named the burger after him. And I thought, I saw it, and I go, oh my God, how could he have done that to himself? But his mom, though, when he died, his mom came out, and said he just simply liked cakes and sweets, and she suspects that he just gouged himself, and that's the reason he went into the coma and died, because he is one of those people who, I guess, just cannot resist, the cakes and the whatever, because, not everybody has the same self-control, because, if I go to the doctor and they tell me, you're gonna be better if you not eat this, I'm not gonna eat that. But some people, I guess, just does not have enough self-control to deal with that. But carbs, as you say, and sugar are working together to give you type 2 diabetes.
It's funny because, you can be a type 1 diabetic and your diet progresses your disease state in terms, because if you think about it, by the time most people are diagnosed, they're at least 2 years in of already having the disease state.
Oh.
You know what it's not necessarily that overnight they became diabetics. In many cases, the disease was already there. It just wasn't diagnosed.
Ah, okay. But I thought if you go and have a physical every year, your doctor should know if you're diabetic, shouldn't they?
Well, you definitely would, based on their blood sugar, know what's going on. And usually when you do a diabetic test, the patient should be fasting, and their fasting blood sugar should be less than 120. Mm-hmm. But if they have a random blood sugar of 200, you have to be concerned. So, let's say the person says, I have increased thirst, and I notice I'm losing weight, and I notice I'm going to the bathroom quite frequently to urinate, then your eyes should be wide open and you're kind of alert. And then, based on their family history, that's also something that, you take into consideration.
Mm-hmm. Are fainting spells part of being diabetic?
Say that one more time?
I said, are fainting spells part of being diabetic, or is that a sign?
In many cases, people who usually have syncopal episodes, with just passing out,
mm-hmm.
if it's associated with diabetes, it's often because of a low blood sugar, what we call hypoglycemia.
Yes.
So usually your blood sugar is less than 70. And in that case, they often pass out. Sometimes they have increased sweating, things like that. But yeah,
okay.
It can be associated with diabetes.
All right. We're staying in the medical vein this evening, so with Dr. Melanie Simpson, we're gonna, because I truly believe that I've never seen anything like this in terms of diabetes, because every other person that you meet or that you bump into is diabetic, and I'm going, what is this? Are they putting something in the food that's making people diabetic or what? Because it's all of a sudden, it's like an explosion of diabetes. I can understand in certain cultures, like Spanish people, there's a great epidemic of diabetic patients there, because their diet consists of a lot of starch, from yuca to taco to, soft taco, hard taco, rice, that's their diet. And if you look at something like yuca, which the other people from the other parts of the Caribbean, the Eastern Caribbean islands and stuff, they will call it cassava. It's the same thing that the Spanish Latin Americans will call yuca, right? And they fry it, they boil it, they eat it every way you can think of. So their diet is susceptible to that. So when I hear, they go to some places in the U.S. where there's a concentration of people from Mexico or other Spanish countries, and they do have, especially Mexicans, a lot of the young people are diabetic, and I'm going, wow, this is just insane. And these young kids have to be taking insulin, and it's, you could see the frustration in their faces, because they're young. I mean, who wants to be shooting up with insulin all the time as a kid? It becomes a burden almost, if you will.
And the other problem is it's not necessarily just the foods we eat, but sometimes portion sizes have a lot to do with it. Because sometimes you eat way too.
Okay, we didn't get that, Doc.
Oh no, I was saying in many cases portion sizes.
Portion sizes. Okay.
That also affects you because, if you're eating way more than you really need, you're taking in too many calories, and then those calories have to go somewhere. And if you're not, doing, let's say, Typo or one of these other exercise programs or something, or you're not just regularly exercising and you're very sedentary and just kind of sitting on the couch and watching television and going shopping and not really exercising actively to burn calories, then you're going to savor those calories and they're going to hide out in your body, and at a later date they present themselves with a disease process.
Right.
But not only that, our society is big on juice.
Yes.
A lot of juice, and juice has sugar, and more sugar. And a lot of children, parents will say, oh, they drink some water, and then when you actually kind of inquire about how much water they drink, the ratio just really doesn't add up.
Okay, so
that's a big factor that we have to take into consideration too.
Okay, all right. I'm moving on now to bipolar because I'm like Zeta Jones, which is Michael Douglas's wife. She is now bipolar, and a few people that is in the public eye, and a few people that I know off the public eye are. All of a sudden being diagnosed to be bipolar. What are the signs of someone being bipolar?
There's two different types of bipolar disorder, and you can either be bipolar type 1 or bipolar type 2, and type 1 is with mania, and I'll explain that in a second, and type 2 is hypomania. So when a patient is manic, they're extremely unconcerned about the things they do. So, for example, they're the kind of people that would go out and they would run up a credit card bill, $10,000 in one day, and not really care about it and not think twice. They don't sleep for many days, and really, they're just functioning based on not sleeping. And then you also have situations where, in some cases, they might become extremely sexually involved with whomever, whenever, wherever, and not really care too much about it.
Wow.
So the manic part, and then their speech is what we call pressured speech. So they're just rambling on and on and on and on and on and on. As opposed to you're somebody who just naturally speaks very fast. Their speech is just very pressured, it's very heavy, and it's very fast. And they don't really sound in many cases like they really concentrate what they're doing or saying. So it's it's very, very concerning when a patient presents like that. And then also a depression portion to that. So they have the part where they're really manic, and then there's the part where they're extremely depressed. And then in the case of hypomania, they're not as outright in terms of going out and shopping. They still have traces of that, but it's not as extreme as somebody who's completely manic. It's almost, in some cases when they're manic, some people would think of them as almost psychotic, because it's just very abnormal behavior. So.
Wow. And those, they're normally on some kind of medication just like people who are diabetic to control this?
Yes. A lot of those patients take the particular drug called lithium, and lithium has its own side effects.
Side effects, lithium, yes. Okay, all right. Wow, we're covering quite a few medical things this evening. I hope we're helping some people out there, and we welcome you again from around the world and in the United States. This is the Diana Wright Show live at the 8 o'clock hour. My special guest is Dr. Melanie Simpson. She's a general practitioner. Hence, that's the reason I'm giving her a whole gamut of questions for you. Go ahead, Doc.
The only other thing I wanted to interject and say is with bipolar, those people, besides depression, they can have periods where they're extremely happy or just being cross or irritable. So
so they're from one extreme to the other, being happy or being sad.
Yes, that's what it is.
Okay, so wow. So, well, don't go out and be diagnosing all your friends as bipolar now, okay? If they're extremely happy and then extremely sad, because that's just one little part of what Doc is talking about, all right? So, because I know people, they listen and they go, okay, I'm just going to be watching out for you.
It's funny, some people don't diagnose, and I really would not advise that.
Okay, all right. Okay, let's talk about hepatitis, because a lot of famous people seem to have this, come down with this hepatitis B, C, what. Could you just kind of give us a quick overview of hepatitis and the different forms?
Okay. So hepatitis is an inflammation of the liver, and of course the liver is a very important organ that detoxifies the body. So if you have a disease process occurring in the liver, then, medications that you take that need to be broken down to a state where they'll actually do for the body what they're intended, may not necessarily occur. And, people who like to drink, the liver also detoxes, the alcohol that you take into your body as well. So if your liver is not functioning the way it should, and then there's an extremely large blood supply that goes through the portal vein of the liver. So if your liver is not really functioning the way it should, then you can only imagine all the complications you can potentially have. In addition to that, it also makes factors for coagulation, and we talked about that previously, which has to do with, if you get a cut, being able to control the amount of bleeding that occurs because of that cut. So you can see it's an extremely important organ. So with respect to hepatitis, there are different forms. So there's a type A, type B, type C, type D, type E. Type
A, B, C, and E? A, B, C, E.
Yes.
Which is the worst one? Which is the worst one of the bundle there?
I would dare to say all of them.
All of them? So all of the hepatitis numbers are just bad.
Sure. Type A is usually associated with food. So, for example, many times when people are going overseas to other countries, and they develop, food poisoning or whatever the case might be, in many cases, fecal or oral transmission is how hepatitis A occurs, and in some cases, for some people, it could be deadly.
Okay.
Severe nausea, vomiting, things like that can occur. And then with type E, you worry about that one in particular because it could be deadly in women that are pregnant. Type B, the transmission for that one is you can get it what they call parental. So basically, if somebody is an IV drug abuser or actually has intercourse, that's how they can contract hepatitis B as well as C.
Okay.
And hepatitis B and hepatitis C are two that you have to be really, really careful of because it can lead to hepatocellular carcinoma. And what that means is cancer of the liver.
Okay.
Any type of cancer, no matter what it is never a good thing. Even if it's a benign, state, it's just never good because that means your cells that are supposed to be functioning normally are now not doing that. And so with type B, patients get vaccinated against that. So, for example, someone, for school purposes,
right.
Hepatitis B series, if you're in the medical field, you'll get a hepatitis B series, which is a series of 3 injections. And then the other thing is when you're a child, that's the first vaccination we give to the child in addition to vitamin K. Right. If a boy, for example, is going to be circumcised. So, that's something that's very important that we actually do give to the babies. So hepatitis B in many cases should be a rare occurrence because of the fact that we do have a vaccination available.
Right.
So if a patient has full-blown cirrhosis of the liver, so, in some cases you have patients who actually are chronic alcohol users. Right. And they end up having, significant liver disease. Then there are treatments out there for hepatitis B, hepatitis C. hepatitis C seems to be the most common, given the fact that we do have a vaccine for B, and also hepatitis A, we have a vaccine as well.
Mm-hmm.
So for a patient that presents with hepatitis C, it's kind of a long haul in terms of treatment. And the reason I say that is some people do not respond well to the treatment, and we can test to see what genotype that patient is and whether or not they're going to be responsive to therapy.
Mm-hmm.
One of the things is medications come with side effects. So depending on the kind of therapy that's chosen for that particular person, they may have significant side effects and may not be able to tolerate treatment. And so they may end up in a situation where their only option is a liver transplant.
Ah, okay. All right. And E is the one that is?
That's also fecal-oral transmission. Usually people eat certain kinds of foods that would affect them,
Mm-hmm.
and that's the one that you have to be really careful with a woman that's pregnant because it can be deadly.
Okay. All right. Okay, Doc. Well, it's just about time to go. Final thoughts before you go. We didn't get to a few things that I have here, but we'll tackle them next week.
Sure.
Yeah. So give us your final thoughts before you go this week.
I would say my final thought is, just the fact that, being educated is extremely important.
Mm-hmm.
I do believe that, when you go to your doctor for a routine evaluation, or what some people call a yearly physical,
Mm-hmm.
have your series of questions that you'd like to ask. If there are things you're concerned about, you can read about things on the internet.
Mm-hmm.
That's fine. But, not every, like, for example, WebMD, somebody's opinion is posted on the internet. I could go on WebMD and, raise a particular subject area and write about it. So,
Mm-hmm.
That's not always the only resource that people should use. There are other resources that are available. Of course, for us as practitioners, there's multiple medical journals that we use.
Right.
However, I would definitely advise people that if there is any kind of disease process you're concerned about, whether it's a friend, it's a family member, educate yourself, because you don't want to be naive about something that you can, potentially be treated for if it's necessary to be treated for something, or just in general, knowledge is power, and, they always say what you don't know won't hurt you, but the truth is what you don't know can hurt you.
Yeah.
So that would be my advice, is just educate yourself.
Okay.
Don't take anything for granted.
All right, Doc. Thank you so much for running the gamut with us this evening, and have a great evening. And we will talk to you next week. I have lots of stuff I didn't get to, like the medical marijuana, tuberculosis, which is we hear is affecting Nelson Mandela. So, we'll get to all of that next week, and some other things like, we heard the doctor saying that the annual physical is really not necessarily the greatest thing for you to be doing, blah, blah, blah. So we'll get to some of those things next week when you come back, and some other things that I had on my list that I didn't get to, because an hour seems to go really fast when you're talking about medical issues. I don't know if it's because it's more complicated than everything else or what. But anyway, thank you so much and have a great evening. And hopefully next week Skype will be working so we can actually see you when you're speaking. All right. Thank you. Take care.
All right. Thank you.
Okay.
Bye-bye.
All right, that was Dr. Melanie Simpson, and she joins us every Tuesday as we talk about lots of a wide gamut of medical issues and different things. A lot of times we focus on sex and relationships too and all of that, but I just thought this week that there were so many medical things happening that I just needed to focus on it and get some information out to you, and I try my best to do so. And because she's a general practitioner, she can kind of cover the gamut, so it's kind of a little easier to go through. So next week we'll get through some of the things we did not get through today, but I thank you so much for joining me today. Don't forget, April 30th is International I Love Me Day. Love yourself. Please, please, please love who you are, and do not allow yourself to be abused and belittled by your significant other or your spouse. It is crucial for you to stand up and take charge of yourself. And remember, my words for this morning was faith, hope, and prayer. Keep that in mind as you go about your day. Do join me tomorrow morning again for the Diana Wright Show. It's Wellness Wednesday, but Dax is in Iceland, so I'm not so sure what you're going to get in the morning. So you're just going to have to tune in and find out. A surprise, maybe. I don't know. We'll see. So don't forget, if you love something, set it free. If it comes back, it's yours. If it doesn't, it was never yours. And don't forget, October 5 is the party, the white party. So start getting your white outfit and your $30 ready to go. It promises to be a great one. We're going to try to get someone from Save a Life Jamaica Foundation. I don't know if Novelet Gale wants to do that, but we will see. They will tell us a little bit about the party, where it's going to be. The tickets are now on sale, so you can do your part to save someone else's life. Yes? And if you can't make the party, you can just go online and donate some money. The same $30. Or, we take more if you can give more. But you'll know that you're doing something for someone else, which makes you feel fabulous. Hope you had a great day today, and hope your evening will even be better. So, as I say, adios, ciao, and au revoir. And don't forget, 3 little words. I love me. It's a sandwich. Remember, it's a sandwich. The word love in the middle. And I and me are the 2 pieces of bread. So let's sandwich them and make it a great day, a great evening, and continue to be good and be well. Once again, thanks for joining me from around the world and in the U.S. This is Diana Wright. Ciao. Ooh.